and Dr. Melody Ennis, Director of Family Health Services in the Ministry of Health and Wellness. We'll begin with the update from the Minister.
Thank you very much, Stephen. Good evening, ladies and gentlemen. Welcome again to another COVID Conversations. Update on our COVID status and the response of the government. We thank you again for joining us on this another occasion. We've had a very active week, and certainly active past few weeks, with numbers increasing to levels that we have not seen before, high positivity rates, which is more worrying. And we continue to encourage Jamaicans to respond to the protocols that have been advertised or announced. And we continue to work in public health with all our stakeholders, of course, and at the highest possible level of policy, the Prime Minister, the Cabinet, to respond to this pandemic and its impact on Jamaica. During the course of this discussion, we will outline a few things. We will look at our regular epidemiological report, and we have our chief epidemiologist, Dr. Karen Webster-Carr, here. Thank you very much for being here. And she's the expert on these things. She's not just a doctor, she's a statistician, and tabulates all the numbers, and she has a team. So she'll give us an update on that. Then we go into a vaccination plan and an update on that. And then we have the Permanent Secretary to my right, who will give an overview of the budget, an area that has been discussed in the past week or so, which we think we need to clarify if necessary. And then, of course, we'll entertain your questions on any matter related to COVID. So let's begin now with our national epidemiologist, Dr. Webster-Carr.
And everybody. So right into the statistics or the numbers, we are at 20,310 as of yesterday. You notice in the listing, we now place antigen testing. However, I must note, or it must be noted, that it's not just 43 antigen tests that were done, but any antigen test that was not considered positive is sent on for PCR. So we have to be careful, the public, in calculating positivity rate just by looking at these numbers, as we are used to for the PCR only. There are about almost 7,000 active cases, as we saw on the next slide, and the death rate or the case fatality rate is 1.9%, and it is about 14.1 deaths per 100,000 population. Who is affected? More females than males, 55 to 44, 56 to 44. But when we look at the deaths, more males are affected, and the percentage is, the next slide, the percentage is different. So 44% female, while we have 56% males. And males are more likely to die from COVID than females. When we look at the age, persons 20 to 29 has the highest number of cases, followed by persons 30 to 39. But when we look at the deaths in the next slide, persons who are older are more likely. So persons who are greater than 90, there's a 1 in 4 chance. Persons 80 to 89, 1 in 7, and 70 to 79, 1 in 10. Among persons who have died, 98% had one or more comorbidity or risk factor, with 72% were over 60 years, 56% had cardiovascular disease, mainly hypertension, 44% had diabetes, and 14% had chronic kidney disease. When we look over time, which is on the next slide, we note that in the last few days, the number of cases exceeded what we saw in August to September. And however, the rate of increase was different. On the next slide, we look at, it's a little clearer when we look at the dotted line, which is our 7-day moving average, and we see how the numbers have changed over time. The next slide gives our estimated reproductive rate, and this shows that we are at about 1.2, 1.3. We're hovering over 1. Once we are over 1, we are continuing to increase in cases. So let's look at the next slide, which gives a parish distribution of over time. Almost all parishes are greater than we were at August into September. And parishes such as Portland, St. Thomas, that's not as high, are increasing currently. So we have to watch all parishes. When we look at the weekly numbers, it's clearer the increase that's there. And the deaths have started to increase as well. When we look at the positivity rates over the weeks, over the last few weeks, the positivity has been increasing. So while we are increasing the number of tests, the positivity rate is increasing, which is telling us that it is a true increase that we are seeing, not just because we are testing more. So when we look across the country, this gives us the absolute numbers for over the last 2 weeks and cumulatively. So KSA, St. Catherine, St. James, and Manchester has the highest number of cases in the last 2 weeks. But when we look at the next slide, when we look at the rates per 100,000 population, we are seeing St. James, Trelawney, Manchester, and Kingston and St. Andrew having the highest rates. For the deaths, these are the number of deaths by parish, and St. Catherine has the highest number of deaths, followed by St. Andrew. But when we look at the rates by parish, Trelawney, Westmoreland, St. James, St. Mary, St. Anne has the highest rates. These are the communities that are currently affected, well, in the last 2 weeks, with the greatest number, darker pink with the greatest number of cases. When we look at the rates, which in the next slide shows what has happened, so almost every community in Jamaica has been identified. So we know every community has been affected. When we look at the top 20, Old Harbor, Spanish Town, Mandeville, Gregory Park are the communities that has the highest number of cases. And that, Minister, is the presentation from epidemiology.
Thank you very much. Thank you very much, Dr. Webster-Carr. So there you have it, ladies and gentlemen, an update as we normally provide on the status of COVID in our population. A few key points to note. Firstly, we are still experiencing increases. The productivity rate is showing that we are still on the up, and therefore the actions by the government for further restrictions, as was announced a week ago, to my mind are justified, and we want to urge Jamaicans to continue to observe those protocols to the extent that you are, and those who are not, encourage you so to do. The death rate of 1.9%, to put in context, is below the global rate. I think the global rate is just over 2%, 2.1 or 2.2%. So we are still doing better than the rest of the world if we look at that, the average, and make the comparison. The other point worth noting is that we have well over 7,000 active cases that we know of. And I say that we know of because for every active case that you know of, there are multiples of that you don't know. Am I correct?
Correct.
I'm learning your discipline. I think it's somewhat 8 times or somewhere in that region.
Depends, yes.
It depends, okay. So if we say we have X10, we could probably have 60 or 70. And that is worth noting. And that is why it is so important for you to observe the protocols, the mask wearing, the sanitizing, and the physical distancing, because there are cases out there that are unbeknownst to us, not visible to the eyes, and certainly can facilitate spread, which is accounting for the cases that we're recognizing as more people turn up or as we do our spot checks, if you will. The final point I want to raise is that we continue to prepare our hospitals to accommodate those persons who need hospitalization. And you would have seen in the past week where we announced the additional bed count, 133, when all are totaled, which includes the St. Joseph's new wing, as well as the additional 21 beds at St. Joseph's, the 36 at Falmouth, the field hospital that the U.S. donated of 40 beds, which is going to be relocated to Spanish Town. There are some other adjustments taking place, but it is certainly a fairly large increase from what we have. And we, however, want to advise citizens to please take the precautions, because hospitalization is a big concern and we don't want to get overwhelmed. On the issue of the vaccination plan and the update, we continue to work to secure COVID-19 vaccines through our arrangements, starting with COVAX, which we have spoken to at length in the past and in the Parliament and elsewhere, and also, very importantly, trying to secure vaccines through a number of our global partners, institutional partners, like in the region, CARICOM, but also bilateral arrangements with governments and manufacturers. Currently, we are expecting the AstraZeneca vaccine manufactured by SK Bio, Republic of Korea, and the Serum Institute of India, respectively, as well as COVID-19 vaccines manufactured by Johnson & Johnson and Moderna. And there are active conversations going on to secure from these manufacturers/governments, and the details of that we can go into if you have questions, but we are not dependent on COVAX alone, and that's an important point. What I will say that is worth, or a sort of shift in the narrative, and you heard the finance minister today in Parliament, and we thank him for his presentation, particularly around COVID, is that the government has taken a shift in the approach to securing vaccines. Unlike in the past when we said it was 16% we expected during the course of this year, although in fairness, we did say we would seek outside of COVAX. COVAX had made a commitment of 16%, 450,000 people. We are in a position now, based on the budget, to say that we have the resources to secure vaccines for some 2 million Jamaicans. And that budget was announced today, which means that we have allocated over 34 million US dollars, or some 5 billion Jamaican dollars, for these manufacturer facilities. And in addition to COVAX, we are also, as I said, in talks with India, Moderna, and the private sector, and the African Medical Supplies Platform through CARICOM. So the discussions that are taking place now are around how we secure the stocks of vaccines, not whether or not we can afford it. We have blocked those funds, the government, and therefore it really now is a function of whether we can get it. Now I want to say that, it's a challenge. I mean, the 3.5 million doses that we're hoping will be procured, which would mean some 2 million Jamaicans would be able to get the vaccine this year in 2021, has to be a function of the availability of the stocks. Now, I don't know to what extent we have been following the politics of vaccines globally, and I classify it as such because it has become a geopolitical discourse. You only need to visit the website of the World Health Organization to hear the Director General, as well as others, speaking around wealthier countries buying up blocks of vaccines, poorer countries not having access, countries committing to purchase but not having the vaccines. I could name a number of countries that have secured or have expressed an interest in securing vaccines 2-3 times their population, but they have the money, but they don't have the vaccine. And one of the big thrusts going forward is how do we secure the vaccine, but let the public be assured that we have the resources to commit once the vaccines are available. In addition to that, remember too, that our commitment is to secure vaccines that are safe and therefore go through a particular process, and that's how we have operated to date. So that's good news. We can buy up to 3.5 million doses, 5 billion Jamaican dollars, 2 million Jamaicans, and that's a commitment that the government is making to the populace as part of the COVID response. The other matter I want to raise quickly before the PS speaks to the budget is the issue of healthcare workers and the concerns that have been raised in the public domain, but also otherwise around healthcare workers and their COVID incentive payment or hardship payment. There was a hitch in that there was a budgetary period which ended, and so the incentive payment was essentially discontinued or had expired, the period. But I'm happy to announce that we are again going to be reinstating that incentive payment, and there is an allocation of some 540 million Jamaican dollars to the healthcare worker incentive program for the next 9 months. And, I don't need to underscore the importance of our healthcare workers. I want to again say that they are absolutely critical to the COVID response, have been critical, have been our heroes in many respects, and without them, we just can't make it work. So, we know they're under stress, we know them as much support as we can. This is the government, the ministry's leadership, and the incentive scheme we have and will resume, and there's resources to support that. So 540 million for the next 9 months for this incentive scheme. In terms of the vaccination budget, a very important part of the support is to have the budget to spend on what is required. And I know there have been some questions raised about the budget, and we have taken a position that we are going to be transparent and accountable. We have nothing to hide. To the extent that budgets are allocated, it's allocated based on an assessment of the challenge, of the risk, and what is the best spend to get the best return for the good of the population. And whether it is in communication and marketing or it is in PPEs, we have taken time and spent an effort to ensure that when we make a request from the Ministry of Finance, from the government, from the cabinet, it's based on an information and a need or a gap that has to be filled. And I've seen various comments and insinuations and accusations and condemnations in some instances. But frankly speaking, to date, we have delivered. as a government, as ministry, on securing PPEs. Yes, we have had periodic shortages. We have delivered on securing additional space, additional beds, ventilators, and we have maintained a consistency in communicating with the populace in a manner that hopefully persons would be in no doubt as to what we're doing, that would address concerns that they have. And indeed, if we weren't doing it, then there'd be other questions that would be asked, and speculation and assumptions. And in a crisis situation like this, communication is absolutely critical. Having said that, there are some clarities that will be required. So I'm going to ask the PS to just go through the budget as it relates to what has been spent and what is projected to be spent. And certainly after, I'm sure there'll be questions asked around that. PS?
Afternoon to all those persons watching online and to my colleagues here in the EOC. Today I will be speaking about the budget, but I want to contextualize it, Minister, by speaking about what we have done to date, what we have received to date, and what our expenditure has been to date. So, as you can see from the diagram, we have received approximately $8.8 billion from the Ministry of Finance and the Public Service for expenditure on COVID-19. And of that amount, $8.4 billion has been spent on varying activities. If we look on the next slide, we'll see that based on this information, the majority of the resources have been transferred to the 4 regional health authorities. Approximately $2.9 billion of the total amount received was transferred to the regions. Of the amount that we have received, we have also expended approximately $1.8 billion on drugs and another $672 million on medical equipment and supplies. And this is where you talk about our PPEs and other sort of sundries used to support the delivery of services. There is an amount that has been transferred to supporting ministries, departments, and agencies, the Ministry of Local Government, the National Solid Waste Authority, those agencies that are critical to supporting us in our work. There has been an amount that has been transferred, approximately $379 million or $380 million approximately, has been transferred to those agencies to assist the Ministry of Health in providing the services necessary to conduct this effort. Additionally, we have done a lot of construction work. Minister, we have retrofitted almost all of our Type B and Type A hospitals to provide for additional space, and we have created additional infrastructure to include the 2 COVID wards that we have constructed, one in Falmouth and the other at St. Joseph Hospital. And of course, we have paid our COVID incentives and other allowances amounting to some $686 million. And public education advertisement of $189 million have already been committed for all of the public and behavior change communication strategies that we have undertaken since the beginning of our experience with COVID-19. This is just to highlight some of the high points of expenditure in terms of what we have had to do in order to achieve some of the gains that we have so far. And if you look at our next slide, we are going to now talk about what the new COVID budget looks like. And I say new COVID budget because you will recall that when we crafted the first budget, it was in the context of a phased approach, looking at first phase being 16% of the population. Now we have 2/3 of the population that will be vaccinated within this year. And therefore, the entire budget framework has been adjusted away from the original $2.9 billion that was set aside for the entire budget experience to now some $6 billion that will be utilized to support the infrastructure necessary for vaccination. So as we move away from the non-pharmaceutical preventative methods in terms of our infection prevention and control program to our vaccination program, which is our which are pharmaceutical intervention for prevention, we will have we see this shift in our expenditure outlay. Minister, you have already spoken about the different facilities that we'll be utilizing to acquire vaccine, and we speak first of our COVAX facility. And COVAX has committed to us to use the AstraZeneca. I don't know, the spelling might be off for AstraZeneca, but the AstraZeneca vaccine. And from that facility, we are anticipating 935 or 936,000 doses of vaccine at a price of approximately $4.60 US. On the African platform, medical supply platform, there are 2 vaccines that are going to be provided through that platform. The AstraZeneca from the Serum Institute in India and Johnson & Johnson. Please note that the Johnson & Johnson has not yet received approval from the World Health Authority organization, but the Johnson & Johnson vaccine is anticipated to go before that adjudication body, and we intend to start our negotiations from now. And why is it important for the Johnson & Johnson? Because the Johnson & Johnson is a single-dose vaccine, and we intend to utilize our best efforts and best negotiation skills through the National Health Fund to acquire these doses of vaccines through the African platform. And so from the African platform, we intend to arrive at about 1.5 million doses of vaccines at the prices that you see outlined there. There's a generous donation from the government of India of 50,000 doses of vaccine from the Serum Institute of India, and that is also forms part of our quantities of vaccine that we intend to acquire. We are in active negotiations with Moderna, and that collaboration with Moderna is anticipated to acquire approximately 600,000 doses of vaccine at a price of $33 per dose. We also have an arrangement that we are pursuing through the private sector with AstraZeneca for 500,000 doses. A private sector company is collaborating with the government, and more will be said about that once the ability of the government to disclose those details are made more apparent. So overall, Minister, for vaccines only, now bear in mind that this is just vaccines. We are talking about 35 million US dollars at about converted to be about 5 billion Jamaican dollars to acquire 3.5 or 3.6 million doses of vaccine by the end of the fiscal year. What I need for everyone to take note of is that of all the vaccines there, Johnson & Johnson is the only single-dose vaccine. So all of the others are double-dose vaccines. So if you remove the 500 from the 3.5, you're left with the balance, and then you divide that by 2, and you see you come down at approximately 2 million persons to be vaccinated in the population by the end of the fiscal year. And once we look at our next slide, we look at all of the other attendant costs associated with vaccination. And here is where we had the kerfuffle, if for my where there was a misunderstanding in my estimation, a misunderstanding of the assessment of how we arrive at this budget. And this budget is a composite of several different activities. We have to buy freezers, which we have initiated a procurement for through PAHO WHO. We have to buy syringes for the total number of vaccines that are procured. We have to buy syringes. We have to purchase some additional vehicles for the logistics management in the regions. We have to rent spaces. We have to conduct training. We have to develop material and print the material for the training. We have to hire temporary staff. We have to pay overtime and other benefits. We have to provide accommodation for staff based on our logistic operation. We have to have hired a consultant firm at $22 million for the year to provide support for the communication campaign. Every time you hear a COVID ad, there's a cost associated with that, whether or not you hear it on the radio, on all the radio stations, whether or not you see it on the television, whether or not you see it in the newspaper, or whether or not you see it on social media. There's a cost associated with that set of operations. And so the placement costs associated with the advertisement and the communication has a component in the budget, and we have allocated an amount for each month of interplay that we have in the media space. We have to look at other types of public education sessions on the next slide that will look at how we go into the community and the different stakeholder groups that we must consult with. We print information, education, and communication material. We have to look at the vaccine policy, and because what we recognize in our implementation is that we don't have a holistic vaccine policy that looks at the vaccination of the entire population. We have a vaccine policy that speaks primarily to the vaccination of children, but we now need to look at the vaccination policy as it relates to the entire population, adults, the elderly, male, female, old, young, and we need to come to a consensus as to what is the policy position on not just COVID vaccine, but vaccination in general. Then we have to talk about our standard operating procedures and codifying those standard operating procedures across the regions and health facilities, so everybody is using the same playbook to implement and outlay the same procedures for vaccination. We have a web-based vaccine management system that needs to be upgraded, and we have our micro-planning sessions that are necessary for the implementation on the ground. And of course, research and data management are critical components of any vaccination program. So, Minister, all in all, this is what the budget, the $6 billion that has been provided by the Ministry of Finance and the Public Service is to do. We welcome any questions. But, Minister, I need to make a point that, and I've heard you say it before, we don't always get it right. This is the first time all of us around this table are undertaking these types of intervention. We welcome criticism. We are not afraid of criticism, but don't expect us to get it right all the time. Thank you.
Thank you very much, PS. So there you have it, the budget as outlined for COVID, what we have spent, what we intend to spend, and in particular, the sourcing of vaccines. I just want to make it clear that we are pursuing a range of options involving a number of manufacturers and countries. The key protocol of a vaccine that goes through the rigors of approvals is important. And it's important because this is what we have done, and it has worked for us in the past. And there is an expectation that the appropriate trials be done. And in this context, where it's emergency approvals, where there's increased suspicion around vaccines and its efficacy based on the time period since COVID, it's important that we follow that process. Now, there are other challenges, as I've said earlier, and that is accessing. And there is a global rush for vaccines, and the capacity to manufacture vaccines is just not keeping up with the demand. And in some instances, some countries have gone beyond their own population and expanded their demand for a lot more. And many of those countries aren't getting it. And so, we have to always keep focus on the protocols. And I suspect it will be the case for some time to come. And this is going to be our best defense for now. So I remind you of that, and I close at this point to entertain the appropriate, any questions on COVID. Stephen?
Minister, just reminding our colleagues on the Zoom to use the raised hand feature to pose their questions to the team. We're going to begin with Dion Jackson Miller from the RGR Communications Group.
All right, thank you so much, Mr. Brand. 3 questions. Number 1, can the ministry please explain why it took no action to ensure the security of the Jam COVID app after learning on Sunday there had been a security breach, according to Zach Whitaker of TechCrunch, who said it wasn't until they found the app developer on Tuesday that the breach was rectified. Second question, I listened carefully to the budget and so on and the negotiations. Can we at this time now get the timetable for the arrival and distribution of the vaccine, the who, when, where, and how? And the third question, I know I asked this a couple of days ago, but it's obviously important, trying to find out if, since I last interviewed the minister, if there's been any progress on ensuring the COVID incentives to doctors are paid.
Okay, so it sounds like all 3 I may have to take on. The first one, I am going to redirect or respectfully decline to elaborate on because and direct the queries to the OPM, who is managing the process and will respond appropriately as it relates to that data breach, if you will. So I'm going to decline to comment with any specifics on that because an investigation is taking place, and at an appropriate time, a response will be given. Just to reassure the public, however, that we meaning the government, including the ministry, are very clear on the need to secure the personal information of those who use the app, and in particular, as it relates to public health, we have had a long-established tradition of confidentiality in terms of patient records. So more will be said on that in due course. On the second issue of the arrival of vaccines, the Permanent Secretary has presented the budget and also the sources or potential sources. Now, there are other sources that we're pursuing, and there's likely to be a need to make some shifts as we go along. I did say that supplies are limited, are not keeping up pace with demand, and so timelines or timetables are very difficult to predict. Now, I had made an announcement in Parliament a few weeks back based on correspondence we received from the World Health Organization, WHO. It is based on those correspondence that we said that we should get some vaccines before the end of this month. We're not yet at the end of the month. The discussion is still taking place. What is very clear is that they have now approved the vaccines that they have identified as being the ones that would likely be the first quota or allocation. That's the AstraZeneca India. And so it's for them now to deliver on the commitment that they have made. And I will be the first to inform the country if that timeline is going to be met, and if not, when, because it's very important to keep the country informed. So the closer we get to that end of month deadline, I will give more particulars around the COVAX window. But I can't give more than what was given to me, because to do that would be to speculate and, get into trouble later on. There are, however, other options that are being pursued. And so there is the possibility that we could get some vaccines even before the COVAX facility kicks in. And again, without giving specifics on timelines, I would say that we will keep the country informed on those other initiatives once we have some definitive dates. And the Ministry of Foreign Affairs and Foreign Trade is actively working with us, with Ministry of Health, of course, and to pursue those other options. And the third question is the one around COVID incentive. Well, I spoke to that at length in my presentation. The incentive will be resumed, and there's a $540 million budgeted for the next 9 months to restore a program that had expired, was budgeted for up to a period, because we think it is important and that our public sector workers, public health workers who qualify for the program deserve it. They've been working very hard, and so that program is back on track. Thank you.
Thank you very much, Minister. I think Dion has a follow-up.
I'm trying to understand why the ministry is saying he is yielding to the OPM. I'm not talking about the initial application or the initial security issues. I'm speaking to the fact that the writer said specifically that he spoke to a spokesperson from the Ministry of Health. So in other words, it landed in your lap on Sunday and nothing happened. I'm trying to find out from the ministry what action you took once you got that information.
Right, and I appreciate that, and I could almost predict the follow-up question. Dion, I'm not going to comment on a situation where there are bits and pieces of information and then run the risk of distorting the complete narrative. And what I'm saying to you is that there is an investigation taking place. You have taken the word of a well-known individual / entity, and that's fine. That will be factored into that conversation or investigation. But for me to comment on a piece of an investigation or an incomplete investigation would, frankly speaking, be irresponsible and would also go against the course of natural justice. So I am saying that, hold a bit, the OPM has some jurisdictional responsibilities over the app and its application, as well as a number of other agencies, national security, health, and that's why there needs to be some coordination in determining exactly what transpired and how we can avoid it and how we cauterize any potential issues that may arise. And that's all I'm prepared to say at this time, because to comment otherwise would be to comment on a situation that is unfolding, that is incomplete, and that I think would be irresponsible. Thank you.
Thank you very much, Minister. We're going to go to Kirk Wright from TVJ.
Can you hear me?
Yes, go ahead, please.
Oh, good. So lately, our newsroom has been bombarded with calls from the Bellevue Hospital. Employees at the Bellevue Hospital complaining of not having PPEs. One employee told me just yesterday that she, has to be working in her own cloth mask for about a month now, in addition to which the staff is overworked. My understanding is that about 8 staff members have been tested positive, along with about 23 patients, but The point is the fact that they're complaining of not having gowns, shoe covering, and proper PPE to working. And at one point they were told to wash the mask and wear it again, or just continue using the same mask. So what's the latest with that, Minister?
Raise a couple of issues. First of all, overworked is a common and recurring theme in public health at this time. I think we're all overworked, and it's not a badge of honor, except that we commend all of us who have made sacrifices and are making sacrifices, meaning it's not a badge of honor for the ministry to have its employees who are being overworked. It's a badge of honor for those who are working beyond the call of duty to be making the sacrifices, just to be clear. It is, we're all under stress. We're all fatigued. People are working 18-hour days. I mean, I don't need to be coy about that. We have to just state it as it is. And everybody knows why, right? So, I recognize it. We recognize it. The government recognizes it, which is why we are trying our best to manage and to keep motivating the persons who are involved in this response. Bellevue is clearly not as active in the COVID response, except that they have to keep their internal stakeholders safe. And to the extent that we have issues from time to time, which is the second point you raised, that there was an outbreak, is almost expected. I mean, organizational or clusters of cases is a standard expectation now across the country, private and public sector, hospitals, and elsewhere. And when it happens, there's a protocol that triggers a response to cauterize, to get back on track. So to the extent that Bellevue has a few cases, remember now, Mandeville had 21 cases last week or week before, Mandeville Hospital. Bellevue has 9. Unfortunate as it is, we just have to deal with it. The protocol has to kick in. And the issue of PPEs, now that to me is cause for concern if it is in fact the case. And I will certainly trigger an investigation. I'll speak to the management and the board to find out if that is in fact the case. Because one thing we have tried our utmost best to do is to ensure that our frontline staff are properly equipped to do their work. And there has been periodic shortages, yes, but normally it's not a function of being out of stock. It's a function of just the management of the process, because central storage, movement, that sort of thing. So I will check on that to see if that is in fact the case. I can't imagine any manager telling a staff member to wash and wear a PPE, a mask for a month, you said, or something like that. I can't imagine that, because that would be very contrary to what is the standard procedure. Thank you.
Thank you very much, Minister. We're going to go to Janet Silveira from the Gleaner.
Thank you. Hello?
Yes.
Yes, I have a question. I have two questions. One of them is related to the AstraZeneca from COVAX, which the PS just said would be $4.60 per dose. But in Parliament, the minister said that the cost of 900,000 doses under COVAX would be around $10.55 per dose. And that's a hedge. So what has accounted for the disparity? That's what I'd like to find out. And if we bought into an edge, if we can't opt out for and pay another price. And the other question is, persons have gone on the Visit Jamaica site and they've been vaccinated, but when they ask a question about whether or not they would still have to quarantine when they come into Jamaica, the response that they get is Jamaica has not made a decision yet as it relates to persons who are already vaccinated. And I could have sworn the last week I was told at the same press event that persons who have already been vaccinated would not have any issues as it relates to quarantine when they come to Jamaica. All they have to do is to show proof of their vaccination. So can you comment on that for me, please?
Ask the PS to deal with the budget issues because he has better knowledge of that than I. And then I think Dr. Melody Ennis is online, who is in charge of the vaccine program, family medicine. I'm going to ask her to speak to the rationale for quarantining, having had the vaccine, at least for the time being. So, PS, you want to go first?
Thank you, Minister. So the $10.55 is a negotiated price under COVAX based on the preliminary engagement that they had to have in the market. Now, when they went into the market, they were going into the market with different manufacturers. So Pfizer, Moderna, AstraZeneca, Johnson & Johnson, and each vaccine had a different price. And so in order to negotiate with all of the different vaccine players, they had to negotiate a price that they would commit the governments to paying. And so that price was $10.55. Now that we are where we are, they have now begun to sign the individual supply agreements with the different suppliers, they are now getting a particular price. And the price that they have now for AstraZeneca is $4.06. And so that's the price that we are now committing for the payment for AstraZeneca.
Dr. Ennis, you want to just respond to the...
Good afternoon, everyone. Good evening. Thank you, Minister. So once persons are vaccinated, the primary purpose and investigations that were done to get our vaccines to emergency use authorization was really to look at the severity of illness as well as preventing death. Now, transmissibility was not looked at. It's being looked at now, and there is some indication that the amount of the virus that is in the respiratory tract is lessened when we get vaccinated, but that data is incomplete at this time. So persons can be vaccinated and they can still have the virus and be able to transmit it. And therefore, the recommendation at this time, until we get further information, is that we continue to maintain our IPC protocols of mask wearing, hand washing, and physical distancing. And that includes quarantine at this time. Now, some countries have lessened the amount of time that persons need to be quarantined. They have moved from 14 days to 10 days or even 7 days. And we continue our dialogue and to continue to watch the science in all of this. But bearing all of those things in mind, at this time, we are still continuing to ask persons to quarantine. And of course, that may change in short order, just based on the evidence that's presented to us. So I'm asking everyone to just bear with us until we have it right, because all of this is to ensure that we secure and safeguard the health of Jamaicans.
Thanks very much, Dr. Ennis. We're going to go to Emma Lewis.
Hi, good evening. I just have a couple of queries. The first one is about, in terms of, I'm talking Kingston, I suppose, really. There seem to be so many clusters and so many reports, well, sort of anecdotally, but about workplaces, that are still open and where cases have been identified and employees are still expected to go into work and are quite nervous about it. And I wondered, I mean, does the ministry not have any kind of guidance for employers? I've also heard that some workplaces are getting quite slack with their COVID protocols. So this is sort of something that I know people are worried about who are still going into work every day. Do you have any comments on that? And secondly, I think you sort of partially answered my question just now, Dr. Ennis, but on the vaccine, there still seems to be a lot of confusion. I see people commenting that, oh, it doesn't prevent you from getting COVID at all. There seems to be still some confusion. I don't know if you could maybe clarify some aspects of what kind of protection the vaccine will afford us. Thank you.
Okay, so let's look at why we're getting the vaccines and what they were really studied for. And it really was to try and to prevent morbidity and mortality, severe illness and death. Now, as I mentioned, the transmissibility was not studied, but there is evidence that if we do get the vaccine, especially the AstraZeneca vaccine, then the burden of disease in us is much less, and therefore we would transmit it less. Now, all of this is on the background of getting to herd immunity, which is enough persons in the population so that the virus can touch no one and trouble no one. So until that time, we just really have to continue with the IPC measures. The quicker we all get vaccinated is the quicker we'll get to herd immunity and get back to possibly not wearing the mask and, doing what we consider to be normal before. But there really is not much confusion or any confusion at all. It is the vaccine is not the end of the pandemic at this time. It is the beginning to end, and we just need to follow the process, follow the protocols through so that we can get to the end point in time. For now, we get vaccinated, we prevent severe illness and death, we possibly lower transmissibility, and over time, we will get to where we were before.
Okay, thank you. With respect to the workplace clusters, there is a protocol, as we know, it's online, so persons can read it, and I think it's simple, but it means that all of us will need to follow the protocols. That's what we find happening, is that when we go into do our investigations, there's lapse in the protocol. Persons are eating lunch together, so they don't have on their masks, and there are interactions often outside of the workspace. And many places, no one is wearing a mask in the office. So we all have to read about the protocols, understand it, and follow them.
Thank you very much, Dr. Webster Carver. And go to Cassius Watson from Jamaica Social.
Hey, good evening, folks. I have a question here for the Chief Epidemiologist, Dr. Karen Webster Carr. Doc, you mentioned three parishes, or sorry, not three parishes, three communities, Old Harbor, Mandeville, I believe, and Gregory Park, as that were the communities that were leading the way almost with cases or the surge in cases. Why has there not been, or have you considered or suggested a lockdown of these these communities, seeing that just last year, Portmore, the entire Portmore St. Catherine was closed down just for the cases in the Alarica. And we're seeing numbers here that are almost 5, 10, 15 times that initial number that forced the closure of the parish of St. Catherine. What's the decision making behind not trying to shut down or have special restrictions on these communities right now? Thanks.
That question. So we are at a different place in the outbreak. If we look previously, where we were, we had a few cases. So we're at a different place in the outbreak now, or the pandemic. So the actions differ. And the public health department, I know the St. Catherine Health Department is on the ground morning to night, Saturday, Sunday, public holiday, reaching out to the public. And we continue our surveillance activities, and contact tracing continues. And in these communities, there are extra activities that are ongoing. So there are a number of control activities that can be put into place. So as it is now, the surveillance activities are increased in these communities.
All right, thank you very much. We just have 3 more questions remaining. We're going to go to Owen Brown from Roots FM.
Good afternoon, good evening, I must say. Yes, I have a couple questions here. And the first question is with regards to the persons who are in home isolation. We see over 6,600 persons in home isolation. How is it that the ministry is monitoring these persons now? Secondly, TODS and JATU, they've been talking with us, also taxi operators. They're calling for their inclusion into the first set of persons who will be getting the vaccine or should get the vaccine. Is the ministry considering this sector to be a part of the cohort receiving the vaccine? And the next question is, with the directional numbers, we're seeing most of the females, each day we're seeing the females having most of the numbers. Will there be any targeted messages for the females and how they are managing the COVID-19? And finally, with the Ministry of Education, principals, parents are concerned, teachers are concerned. Is there any conversation now with the Ministry of Education regarding any decision? Thank you.
I'm trying to remember the first one. I remember the one about JATU, the taxi operators, whether they'll be considered in the first batch. There are some priorities, and there are some priorities. The first priority are those persons who have to deal with suspected cases or cases. That has to be the frontline workers, the healthcare workers, to the extent that our constabulary are out there in quarantine communities, that sort of thing. There are other priorities beyond that. I mean, our teachers are priorities. So our taxi operators will be there, but I can't say that they're going to be on the first set of priority list, even though I do think that they are priority 2. The issue of females. Why more female? Oh, you had asked, the first question was about this nearly 7,000 in quarantine and how we are monitoring them. So home isolation. I'm going to ask the epidemiologist to just comment on that, and females, and the female question.
So the health department monitors the persons in isolation. The level of monitoring, it depends on your situation. And so that continues. The more females have been identified than males, which may suggest health-seeking behavior. We know women tend to seek care more. But I thought you would have looked at the men who are dying more than the more males die than females. Men are significantly more likely to die. And so this is where the target is. But everybody needs to follow the protocols, male, females, all.
Can I just respond to, I just got a note here, and I apologize, by the way, for viewers who say sometimes I'm on my phone at these press briefings. It's not an indication of lack of interest, but sometimes I use it to monitor some of the questions that come in directly or otherwise. The SMO at the Bellevue Hospital, in response to the question by Kirk Wright, is stating that there are no shortages of PPEs at the institution. So I just want to say that the senior medical officer is refuting the allegations of shortage. I will still follow up and find out if there's some queries that needs to be responded to, but this is the response. Thank you. Stephen.
Thank you, Minister. I'm going to go to Dion Jackson Miller.
Thank you. Thank you so much. Asking about, I'm trying to understand the relationship between the Ministry of the Ministry of Health and the private labs that it has sanctioned to do PCR testing, because we're being told that the results from those labs don't necessarily feed into the ministry's stats or not in a timely manner, which sounds absolutely ludicrous to me. I'm trying to understand how it is you would have sanctioned labs to do PCR testing where people will be going, and yet that data doesn't seem to sync properly with the other results coming from the public sector labs. Can you explain and tell us why there is a problem there?
Thank you for that. Let me ask Dr. Webster to respond to that, because I think there's a misunderstanding.
So all PCR tests are included in our results. So for a number of weeks, since Caragen came on with PCR, Caragen Microlabs, we have been including their figures twice a week in our figures when we get the results from them, which is routed through the National Public Health Lab. And as other labs come on with PCR, we have been including them. Thank you.
In fact, Dion, it is a requirement for these labs that are approved doing PCR to report. So to the extent to which they are not recorded is the extent to which they may not report, but they are required to report as part of the sanctioning of those tests. Thank you.
Thanks, Minister. Our final person is Zara Burton.
Good evening, everyone. I have a couple questions about the Jam COVID app. I know that Dion asked a couple. TechCrunch, has said that the security lapse has exposed immigration records of hundreds of thousands of travelers. I don't know why. I have a vague memory. I could be wrong, totally wrong on this, but I just want to understand. Were the records that people did on this app and the tracking data and everything, were they supposed to be destroyed? If yes, why would it expose hundreds of thousands over the past year? So that's one question. Also, how much is the private sector contributing to the purchasing of the vaccines? In the article that I read yesterday, it wasn't stated the sum that they were contributing. Can I get an answer on that part too?
On the issue of the data breach, I repeat what I've said earlier. There is an investigation taking place, and I will allow that investigation to determine a response in its entirety around what happened and the nature of the data, what type of data if necessary. I really can't give any additional information around it, around the data and when it was destroyed or what was destroyed. So I have to pass on that because I don't have the information. And I think it would be premature to comment. On the issue of budget, PS, you want to you're probably better able to.
Ms. Burton, if you could just clarify, you're saying what is the contribution of the private sector or the public sector? She said the private sector. So the private sector commitment is not yet finalized, but we do have a particular engagement with a private sector firm that is trying to source vaccines for us, but we would still be required to pay, although they are sourcing for us. So that particular private sector engagement for the sourcing of vaccines, it's 500,000 vaccines that are being contemplated at a cost of $4.60 per vaccine, and the total price on that would be about 34 million Jamaican dollars, or 2.3 million US dollars. But we would still, the government of Jamaica would still be paying. Now, the private sector MOU that was signed is a part of a process wherein the private sector would make a commitment to an actual sum, but that sum has not yet been finalized. What we have engaged the private sector on is the collaboration and the engagement of the private sector in terms of assisting the government in acquiring vaccines for the population.
Thank you very much, Pierce. Minister, those are all the questions that we have from the media. Just hand over to you for your closing remarks.
Okay, thank you very much. Not a lot to add beyond what was said. The highlights of today's COVID conversation media brief is that we still continue to see increasing numbers, both in positive cases. The positivity rate has come down somewhat, but nevertheless still too high to be comfortable with. And we still have a fair bit of hospitalization, and therefore I would say we are still in the danger zone, but working as best as possible to manage and to provide a response to those who need care. For those who don't, we continue to remind you of the protocols that are necessary as we seek to prevent rather than to cure. Beyond that, the public health workers, I think, are well-deserved in benefiting once again from the COVID incentives, and that is back on track. And I've announced the 540 for the next 540 million for the next 9 months, and we want to thank them again for their efforts. The vaccine spend and targeted allocation or suppliers, we outlined that plan as part of the overall budget for COVID, and we are happy to announce that we have the budget to secure some enough dosage for 2 million Jamaicans, 3.5 million doses approximately. We're targeting a range of options, bilateral, private sector, as well as manufacturers and our multilateral partners. A lot now depends on the availability, and we're pursuing that in many different ways. And so, it's left for me to say that COVID continues. It is still a challenge to our population, but nevertheless, it's a challenge we can overcome and will overcome. And I want to encourage our viewers, the country generally, to do what is necessary to protect yourself and to help to protect others. The unanswered queries around the data issue, I want to reassure you that there is no attempt at restricting or avoiding the information that is being sought, but for good order, it is important, I think, that we get all the facts before any official position is taken, and the OPM will provide that as the coordinating arm of the data process. It involves several ministries, several agencies, And I think it's important that we coordinate that to ensure that we have all the information. So as soon as that is available, it will be made available. Thank you very much. This is another COVID Conversations. Thank you for your questions. Have a good evening, and let's continue to work together to overcome COVID. Thank you.
Whoa, whoa, this life, you know. Me tell you nothing no easy about it, but for real we won't quit, no. Yeah. You know, and every day me get up and feeling the same. No. Some days me feel dread. I know a little bit of people I live by when you go through. It's hard when I put it on my bread. Cause no man is perfect, and we all know, and we all have days of feeling low, but I have faith that I hold on to, working hard to see that tomorrow, I better tomorrow, nightmare. Whoa. When no life sweet, but bitter is there. Yeah. We only got one life, so me not living affair. Living in the past won't take you nowhere. It's a new day, the sky is clear. Move on, I've been there. Cause no man is perfect, and we all know, and we all have days of feeling low, but I have faith that I hold on to, working hard to see that tomorrow, I better tomorrow, I better tomorrow.
Reggae month is February. February is Reggae month. Come catch the rhythm virtually. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app. Reggae Month TV. Tune in daily and be entertained and informed.